Hello everyone. Today we'll discuss how obesity affects your health and it leads to some dangerous diseases. Before that, we should know what is obesity, what is overweight. Beforehand, you should have some knowledge about body mass index. It is defined by the formula weight in kg divided by height in meter square. Normal BMI is 18.5 to 24.99. Above 25, it is overweight, and more than 30 is regarded as obesity. Now you can calculate your BMI and you should know whether you are overweight or obese. Now we'll discuss some conditions which are affected by obesity. First, diabetes. Diabetes is the high blood sugar. That means when our fasting blood sugar is more than 126 milligram per deciliter, and postprandial blood sugar, that means sugar after 2 hours of food intake, it is more than 200 milligram per deciliter. It is known as diabetes. But how obesity is related to diabetes? Diabetes is caused by insulin resistant, and obesity is the main culprit for insulin resistant. Also, it enhances the metabolic disorder. Next is hypercholesterolemia or high cholesterol. When there is obesity, obviously there will be high cholesterol because obesity leads to deposition of lipids or fats inside our body, and these fats get deposited, leading to high cholesterol. Among those bad cholesterol, LDL, VLDL, and triglycerides are the main culprits. That means they get deposited inside the vessels and block those vessels. As you can see in this picture, the triglycerides and other cholesterol get deposited inside the major vessels, leading to compromise of the blood flow. And this compromise in blood flow may lead to some serious conditions like heart attack. When the coronary vessels get deposited by this hypercholesterolemia or high cholesterol, the blood flow to the heart itself is decreased. And when the blood flow to the heart is compromised, it leads to ischemia and myocardial infarction known as heart attack. Same thing happens in brain. When the blood flow to the brain is compromised, it leads to decreased circulation inside the brain. When the blood supply to the brain is decreased or diminished, it leads to stroke. Stroke means paralysis. Paralysis may manifest in many ways, and one of the most common manifestation of paralysis is hemiplegia. That means one side of your limb, both hand and leg, is paralyzed. Obesity also increases the chances of gallstone. As the cholesterol level increases in blood, that get also deposited in the gallbladder, leading to gallstones. The incidence of osteoarthritis, that means degenerative bone disease, is increased due to overweight and obesity. As you know, our whole body weight is carried by the major weight bearing bones like knee joint. When there is wear and tear of knee joint, that manifest as osteoarthritis. Overweight and obesity also increases the chances of hypertension or high blood pressure because the compliance of blood vessel is decreased and it leads to hypertension. Also, you'll be surprised to know the incidence of some cancers like breast cancer, ovarian cancer are increased in obesity. Also, in some studies, it is observed that obese people are more prone to depression. That means the chances of depression is also increased among obese people. Now you can see the incidences of so many diseases are increased by obesity. So it is advisable to maintain a healthy weight and maintain your BMI between 18.5 to 24.99. To fight obesity, you should maintain a healthy lifestyle. At least you should do 20 to 30 minutes of exercise daily. If not daily, do at least 150 minutes of exercise weekly. Avoid the junk foods, fast foods, or foods rich in trans fat because they are the main culprits in increasing your overweight or obesity incidence. Always take green vegetables and fruits in your diet. Stress in turn may lead to obesity. So to fight stress, do some pranayam or yoga in your daily routine. How you are finding this video, please comment and motivate me to make such videos regularly. Thank you so much.